Hi everyone, my name's Sarah Barella, and for my informative speech I'm going to be talking about migraines. And I chose this topic because it's something that I, deal with pretty frequently in my own life, and I think it's something that a lot of people can relate to as well. So if you have migraines, I think you'll enjoy this video and all the things I have to talk about. And if you've never had a migraine, hopefully you'll learn something new too. So, for those of you that don't, never had a migraine, imagine waking up in the morning and just having a headache, multiplied by 100. That's what a migraine is. It's not just a headache, it's something that really just takes a toll on your mind and your body because it's just so exhausting. The pain is so intense that it's sometimes, I can go to work and I can power through the migraine, but most of the time I have to take the day off, and that's the case for a lot of people. So moving on to slide 2, I have suffered from migraines since I was 13 years old. On average, I get them at least probably 3 or 4 times a month, and that's a lot, considering that's like a migraine every single week. And sometimes it's less than that, sometimes it's more. It just kind of depends on, different things that trigger my migraines and different things that affect me. So the exact cause of migraines is still unknown, but like I said, a lot of people suffer from them, and according to the National Migraine Association, around 36 million Americans are affected by migraines. So, moving on to slide 3, there's different things that we're going to talk about, things that you need to know about migraines. And coming up, we're going to talk about symptoms, what triggers migraines, and how people who suffer from migraines deal with them. So the first point I'm going to talk about is migraines and what exactly they are. A migraine is more than just a headache, and it affects more than just your head. A migraine is a throbbing headache that is usually on the side of your head, usually on one side of your head, but it can be both sides in more severe cases. The throbbing is usually accompanied by sensitivity to light, light sounds, smells. Some cases people have nausea. I sometimes have that myself when I get migraines. And people even have, sleep disturbance and depression in more severe cases. In my experience with migraines, I do get nauseous, and I can usually tell when I'm about to get a migraine because I have an aura. And we'll talk about that more in the slides coming up, but I get an aura, and that lets me know that I'm going to get the migraine. And once the aura is over, that's when the actual headache, that's when the actual attack starts. So, and most people I think have that kind of migraine as well. But for me, it's like even the slightest movements, just it triggers my head to just throb out of control. I have to be completely still, or else I'm miserable. So usually when it's really bad, I have to take days off of work and just lay in bed all day and do nothing and try to get through it. If you think of like a normal headache, those of you that don't know what a migraine feels like, it's just so much more intensified, and it's like the pressure just keeps building up in your head until it's just unbearable and you can't function normally. And there are 2 types of migraines, and I'll go over those here in the next slide. So slide 5, we're going to look at the classic migraine. The main symptom of this migraine is an aura, which is what I was just talking about. But an aura, if you don't know what that is basically The best way I can describe it is it's a block in your vision where your vision's impaired, and for me, I'll be looking at something, and then the aura will start to form, and I can't see half of whatever I'm looking at. So say I was looking at a person, I couldn't see half of their face because it would just be the aura itself. And what the aura looks like is, the best way I can describe it is like the static on a television. That's what it looks like, the fuzzy lights. It's super weird. The first time I ever had a migraine, I had an aura, and I thought I was going blind. And I was 13 years old, so that was pretty scary for a 13-year-old girl. But I've actually learned to get used to them, and I'm not scared of them anymore because I know what it is and I know how to deal with them now. So the aura, typically it comes probably around 10 to 30 minutes before the actual migraine itself. So people with auras kind of have an advantage because they can kind of tell when they're going to get the headache, and then they can, start to take whatever medication they need to prepare themselves, which is, beneficial. The other type of migraine is called the common migraine. And basically it's like the classic migraine, but you don't have an aura. And this type of migraine, the symptoms can include mental confusion, mood changes, and fatigue. And these are usually experienced about a day or so before the actual headache starts. And moving on to slide 7, both types of migraines can occur, depending on, how often you get migraines. You can get them several times a week or as little as 1 or 2 times a year. It just kind of depends on you and how they affect you and what triggers you. So now that we looked at kind of the symptoms and different types of migraines, we can look at what causes them. So the actual cause of migraines is still not known. It's unclear what exactly causes them, but evidence has shown that it could be changes in blood vessels, chemicals, and the nerves in your brain, how they all react with each other. The theory is the constricting of blood vessels during the headache, actually before the headache starts. Blood vessels can get smaller, and that allows less blood flow. And when the headache actually begins, your blood vessels become more dilated, and that causes more blood to flow through the vessels. And the stretching of the vessels is what actually causes the headache. That's one of the theories that doctors have come up with. They also think that serotonin might have something to do with it, and the way they think that because high doses of serotonin are found before the headache, and then low doses are actually found during the headache itself. So it's another theory. But moving on to slide 9, different triggers of what actually can bring on the migraine. There's all kinds. So these can range from depression, stress, lack of food, lack of sleep, hormone changes, changes in the weather, diet, what you eat, what you drink, bright lights, and certain smells are all kind of different triggers for migraines. I know for me, when I was first diagnosed with migraines, the doctors asked that I keep a log of the food that I ate and just kind of the daily activities I did, so I could kind of see if there was a pattern or correlation between what I was doing and when the migraines were actually happening. And I did find out that certain perfumes that I would wear, that was one of my triggers, and actually sugary food is one of my triggers as well, so I try to stay away from those. So now that we Now that we see what the migraine is itself, and now that we see what the triggers are, we can see, just how hard it is for people that suffer from migraines to actually deal with them and how they treat migraines. There's no cure for migraines. This is slide 10. But the key to dealing with migraines is prevention. In most cases, non-prescription medicines, such as over-the-counter like aspirin, ibuprofen, acetaminophen, those can all help with most migraine cases, but for people that have chronic migraines with severe pain, they might want to look into getting an actual doctor-prescribed medicine. And it's important too, and this is what I found, that once you feel like you're getting a migraine, you need to just immediately take whatever medicine that can alleviate some of the pain. Like I was saying with the Aura, as soon as I start getting the vision changes, that's when I actually take my medicine, and that actually helps with the pain a lot, so I can get the medicine in my system by the time the Aura stops and the actual migraine starts. Okay, so in conclusion, a migraine is much more than a headache. Exact causes of migraines are still unknown, but studies have shown that the reaction of chemicals in your brain might have something to do with it. Migraines affect many people on a daily basis, and although there's no cure yet, prevention is key. And there's tons of different resources out there for people who do suffer from migraines. And that's the most important part, is just trying to prevent them. So thank you for watching. I hope you enjoyed, and I hope you learned something. Thank you.